I know that we start rolling.
Hi everybody, welcome to our 4 o'clock live. I am here with Julie-Ann. Thank you, Julie-Ann, for being here today.
Thank you, Jennifer.
Julie-Ann is a therapist. I adore you. You're amazing. I've worked with Julie-Ann. I know her on a personal level. She's a dear friend of mine. And I just see amazing work that you do with individuals.
Thank you.
And it's really, really inspiring. I've done a lot of therapy in my life, off and on, since I was young, since 12 years old, I guess. I've done therapy off and on throughout the years, and reluctant sometimes, engaged other times. Now I do it on a weekly basis. And so I really respect and look up to people like you that do therapy and help people that are struggling. So I really wanted to talk to you about, well, I have a lot of questions, a lot of questions. One of my questions that I'm always curious with therapists is, what made you get involved with doing therapy with people that are struggling in addiction?
Well, I wanted to be a therapist since I was about 14 years old. And I had gone through my own struggles, and I wanted to be able to give back. So I'm kind of a late bloomer. I did not go and do my schooling until my 40s, until my son was in mid-teens. What really drew me to working with the addicted population was just seeing people struggling within my family and friends. And I was originally from central Wisconsin, and right now it has a huge heroin and opioid addiction rate. So I'm hoping to go back and eventually do a little bit of work back there. But I've been involved in the recovery community since 2014. It was actually my first internship when I was doing my master's program.
Okay. And how was that, doing your internship? Were you at a treatment center?
Yes, I was. Yeah, I was at a treatment center in Irvine. It was a little scary because I and two other therapists were in our internship, and we were the first therapist at this treatment center. So it was, kind of hit and miss, and did some good work and learned by mistakes here and there. But I really, really enjoyed working with the veterans because they've been through so much trauma that I found it fascinating to work through the trauma first. And that's really my main focus when I'm working with somebody who is having addiction issues, is to get through the trauma first when they are ready for it, because a lot of times they're really shy or scared about going through that process until I can make it a little more palatable for them and saying, this is what's keeping you relapsing. So then they start understanding. But I'm open to where they are and trying to go with that flow.
Yeah, I know. I think for myself with therapy, and a lot of times I was very resistant and guarded.
Yes.
And especially at a younger age, with the mentality of, well, what are you going to do for me? How are you going to be able to help me? So for you, how do you overcome that obstacle when you have somebody that's young and that's resistant to treatment, resistant to therapy, but they're there, whether it's through being out of rehab or through family? How do you work with somebody that is resistant? How do you break over that barrier and build that trust and eventually start to work on their underlying issues and get into solution with them?
First of all, I meet them where they are. So I don't ever tell them that they're wrong. I tell them a little bit about my background history and said, yes, I've been resistant at times also. But it's just getting them to realize that we're all human beings. I'm not perfect, they're not perfect. I never ever try to come off and say, I know more than you do, because I don't. I haven't lived in their skin. I tell them they're the experts of their lives. I'm I'm just here to kind of guide you through, and hopefully you're not going to be resistant to it. But I understand. Some of the therapists that they've seen have been not very effective, or they've been by the book. And it's like, if you do A, B, and C, this should equal to treatment, and it's not always the case.
I love how you say that. It's meeting them where they're at and treating them as a human, just like you are, equal in that sense, and not as a superior that's telling them what they need to do.
Right.
And being able to personalize it and use your experience. I find for myself too, working in treatment, that being relatable and also telling them a little bit about who I am and staying connected that way, it does help break that barrier. So I completely agree with you. What are some different techniques, different types of therapies that you do with clients?
Well, first of all, there's really two types that I start with. It's motivational interviewing and cognitive behavioral
Can
therapy.
you explain what those are to someone that doesn't really know therapy but is wanting to know more about it?
Sure. Well, motivational therapy is basically, again, meeting them where they're at, working with the resistance, saying you're not wrong to be doing this. Let's actually work at the resistance and work at what is blocking you from being open to getting therapy. Let's start with that. And then the cognitive behavioral therapy is like what most people understand for therapy. It's what most therapists are trained in. It's looking at the way that they're thinking, the way that they're behaving, what are their worldviews. Is this being negative or positive within their lives? Are they creating their own chaos and suffering sometimes because they can't get through certain mental roadblocks? Because, we all do that. We get very set in our ways sometimes and say, this is the way it has been and this is the way it always will be, until we can sit there and start shifting and go, maybe not. Maybe let's look at other ways of thinking about how you are perceiving the world, how you're being in the world, how you're a person, how you're presenting. Because everybody's not always something. We are always changing. And I think a lot of people that I've worked with have been resistant to change, because that's been one of the things in group therapy has always been like, I hate change, but we have to all go through it, right? Whether we like it or not, it's a constant almost.
Change is inevitable, and we don't like it for the most part, and it's scary, but we definitely have to go through it, that's for sure. With you saying all this, it makes me feel that there has to be just times where it's emotionally exhausting. And I know you say you see a lot of clients in a week, right? And this is a very emotional, personal job, but at the same time, we're also told to not get too personally invested. So how do you deal with all the emotion, all the stuff, all the baggage, everything they bring to these sessions? What do you do to decompress and have that balance and self-care in your life?
It took a while to get to that place, especially working at my first rehab. It was tough because I would go home and I would be drained, and sometimes I'd be crying in my car on the way home, because some of the stories are very traumatic. And I got to the place where I was just like, okay, I'm not going to personalize this. When I drive home, I'm going to throw some music on. I love singing, I love performing, so that's been a godsend. And just learning at this point that whatever they're bringing to the session, whether it's individual or group session, I can relate sometimes, but sometimes I have to say in the back of my mind, this isn't my story, this is their story. And I need to set boundaries. I need to be able to take in their story and bring up the relevant points and then give them compassion and understanding, and try to help them see the world a little bit differently. So it's helping to empower them by not saying you're right or you're wrong, but I will be here to support you.
I feel calm just listening to you. You just calm me right down. So success stories, how does that feel? What does that do for you emotionally when you can actually follow through with somebody and it be a success story? What's that like for you?
It's joyful.
It's joyful.
Yeah, but
Okay.
I know that I was a little part of that. I don't attach myself to the whole outcome because it's what they bring in. It's their hard work. It's their dedication. It's their family and friends supporting them also. But it's also hopefully retooling their self-esteem and their self-worth. Because I tell them, you take you around with you 24/7, period. So let's get you on board for your own life.
Right.
Yeah.
So, good qualities of a therapist. So if you were to describe an ideal therapist, let's say you, what are the qualities that someone should seek out in a therapist?
Somebody that they can relate to. Somebody that they feel is on kind of an even playing field, but maybe a little bit above them, just because they've got to come in and educate the client, but somebody that can help them laugh. I tell my clients I'm going to bring some humor into probably every session, so be ready for that. I hope you like that. And they say, yeah, we love it. We need more of that.
Yeah.
So relatability, because if you go into therapy and your therapist feels like a teacher that you didn't like, or a parent or other family member that came off as harsh, that's the wrong fit.
Yeah, absolutely. So for you, how do you leave it at work and not bring it into your personal relationships? I know for me with work, I have to shut it off and say, okay, I'm not going to talk about work after this time, or have my phone off, or just make a conscious decision to do things a certain way. So for you, how do you do that? How do you manage your time?
At 8 o'clock,
That's it.
that's it. Yeah. And it's, sometimes I'll have clients texting me after hours, and it's just like, okay, is this an emergency? Maybe this can wait. So I have to sit there and go, okay, is this an emergency or not?
Yeah, absolutely.
Because some clients are a little more, they need a little more attention. And I understand that. And I try to be compassionate about that, but yeah, it can be a little wearing at times, but I just, go, okay, if I was in that person's shoes, what would I be feeling like right now?
Yeah. Okay, I got kind of a funny question I want to ask. I just have to ask this question. When you're in a relationship with somebody, okay, well, at the beginning, when you first start dating, and they find out you're a therapist, do you get that intimidated, oh no, she's a therapist, kind of response?
A little, yes.
It's got to be intimidating for people being in a relationship with someone that's a therapist.
Yeah, but my suggestion is that, for the therapists who are dating out there, yes, you tell them you're a therapist, because a lot of therapists, when they're off hours, don't want to tell people they're a therapist because they're afraid that, oh, well, I'm going to get free therapy out of you, right? So my suggestion for people who are out and dating and therapists are, if you think that the person that you're dating, we all have issues. We're not perfect, but if you think that they need help, you tell them point blank, you need to go see your own therapist, because I'm not going to be your therapist, because you have to set that boundary. Otherwise, you're a therapist 24/7.
Right, exactly. Yeah. So you did some international travel. It was kind of the topic of the show, but I really wanted to ask you those questions because I was curious. Well, you traveled to Portugal, right?
Yes.
Okay. So can you tell us about that? What you found, what you were studying?
In 2018, for my doctoral dissertation, I had done some research about what the United States versus the European Union does for treatment as for heroin and opioid addiction. And the title of it is In the Arms of a Synthetic God. Because so many of my clients had told me that when they were high on heroin or opioids, it felt like they were being hugged by God or angels. So I thought that it was an appropriate title. Yeah. I wanted to do a comparison as to what we're doing in the United States compared to the EU. I had come through with my research that Portugal had come up with a fantastic program in about 2000. They really had a problem with heroin use because they're so close to Northern Africa. So a lot of it was being transported from Northern Africa and Afghanistan over to Portugal. They had had a civil war in the late 1990s, and a lot of the young men came back. They were traumatized and they became addicted to heroin. So they thought, they criminalized it at first, and they thought after about 10 years, this isn't working. What can we do that's going to be different? So what they decided to do was put together what's called a dissuasion committee. It's social workers, legal, and medical. So they all work together. So they had the person who was caught because it wasn't technically arrested because it's decriminalized. But when you say decriminalized, some people think, oh, well, all drugs are illegal. 10 days worth is about it. After that, they consider it that you're dealing, and then they deal with you differently. So they put this person in front of the committee, and they say, how can we help you? How can we get you off of this? We've got treatment centers. Do you need job training? Do you need some sort of social services? Let's help you so that you can get back on track and you don't have a criminal record.
Wow.
It is incredible. And when I went over there to Lisbon, there were hardly anybody on the street. There was hardly anybody. And I was just amazed. I went actually to get some information from what's called the EMCDDA, which is the European Monitoring Center for Drugs and Drug Addiction. So it's the equivalency of what SAMHSA and NIDA is in this country, but it's more centralized. So a lot of the European nations answer to them, and they go and do their research, they see what's working, what's not working, and they work together. So it was a fascinating system to see. And I sat down with the librarian in the legal department, and they rolled out the red carpet for me, basically. I was really amazed at what they sent me out with that much research. It was wonderful. I mean, right now they're having a little bit of problems just because they're economically their economics are a little touch and go right now.
Okay.
Yeah.
So in your own personal experience and your opinion for them versus us, right, in the United States, what do you see that's positive over there that we could possibly be implementing over here, in your opinion?
I think that the different parties talk to each other and they have their meetings and they do their research. Here it's so many different stakeholders.
Yeah.
And that's a difficulty. You have the big pharma, and the insurance companies, the medical field, the rehab field, the legal field, too many fingers in the pies here. And it makes it really difficult to get any headway for anybody that goes through the system, because as we both know, anybody that we're working with in treatment has multiple appointments. You know, and
Yeah, it's so true.
And it's hard to get in and give them the treatment that they need and the rest that they need, because they're trying to take care of too many things.
So having it be more organized,
Yes.
and everybody working together, communicating, everyone knows what their role is and actually execute that and do that, instead of it being 100 different things and people kind of get lost in translation. Do you know statistically from when they implemented this till now, or until 2018 when you were there, how much it decreased with addiction or homelessness on average? Or
that statistic right off the top of my brain isn't there, but I know it definitely decreased.
It decreased,
and they became the gold standard of Europe as to maybe we should start looking at implementing their system into our different countries. But you know, I think, again, because of where they're located, they have more of a heroin problem than an opioid problem. In this country, we have more of an opioid problem versus a heroin problem because of the way that our medical system has worked. Because of course in the 1990s here, OxyContin came into play. And I did a lot of research as to how Big Pharma contributed to the addiction rates. And as you know now, a lot of Big Pharma companies are being sued by states.
That's a whole other, we could talk about that for hours, but yeah, Big Pharma has definitely done a number. What is your vision or your dream, if you could just wave your wand and make it the way you wanted it to be, for treatment, for therapy, for like the whole package, the wraparound service? What would you like to see happen?
Prevention.
Can you explain that?
Well, one of the things that I do right now for this round of doing my internship, I'm actually doing therapy or workshops with 1st through 8th graders. So it's preventative in that segment first.
So what do you do with those kids?
Build their self-esteem and their self-worth up, and get them through the bullying, because bullying is really huge. And the kids are really sensitive. They have a lot of things going on right now. Of course, it's COVID and the lockdowns and opening up, and family problems because everybody's in the household and doesn't have a chance to go out and get some fresh air from time to time. And so to me, that I think is key. And also too, I help people understand that, as for adults, young adults from 18 on up, that if you're going in for any type of surgery or you've had any kind of injury, be careful of the opioid use. Be careful of it, because, and I really had to dig for this statistic, 25% of people who start opioids become addicted within 3 days. 25%.
Wow, become addicted within 3 days.
Within 3 days.
Yeah, I mean, I know for myself with my story, I was prescribed originally, and then I'd go back and they'd prescribe a little more and a little more and a little more, and I had no knowledge that it would be this thing where I would become dependent, that I'd have to keep upping my dose, and that, God forbid, I tried to stop, I was going to get sick, and I don't think people, I mean, it's getting a little better, but yes, there needs to be more education with that. And it's so insightful what you said, because when you're talking about talking to children, in my mind, the first thing I think of is the typical educate them on drugs. But the approach, which I think is so beautiful, of building their self-confidence and their self-esteem and dealing with bullying and the real issues that could make them want to detach, want to isolate, want to numb out, want to take that drug.
Yes.
You're absolutely right. That's where it is preventative, and not just telling them about drugs, but really, really building them up because that is the core of it, you know, for whatever reason, for that person, whatever they're dealing with, it's on that emotional level.
Yes.
So I completely agree with that. I love that. How do you find the responses with the young kids? Do they seem self-aware at all? Are they able to express their emotions with you? What do you find working with the young kids?
I'm actually teaching them emotional language.
Emotional language?
Yes.
So what does that mean?
That means we play Jenga, we play a lot of games, but they have a psychological base to them. I found a website that has emotion words on it, so I tape them onto the Jenga blocks. So when they pull a Jenga block, they have to say what emotion it is, and then they have to sit there and say, well, I felt this during this time, or somebody else had this emotion during this time. So I'm teaching them how to start, you know, processing things. When I'm going through this is the word that I can attach to it. Because when we get traumatized, the trauma comes at us, right? We go into fight, flight, freeze, or fold. This part of our brain, amygdala and hippocampus, are on fire. This part of our brain, our prefrontal cortex, goes offline. This is where your reasoning and judgment come in. And then this Broca's area is where your language comes in. That's why when you go through those types of experiences, you don't have the words to attach to it, because this goes offline. You walk away, and sometimes you're numbed out, sometimes you know, you freaked out. It depends on what happens. But we don't have the words to process. And sometimes it's so easy to sit there and go, oh, anger, oh, fear, because this kicks in and it goes, oh, okay, what can I do? And I always teach, do the word, take 3 deep belly breaths, and then what choices do you have? Sometimes it can be as easy as that, to do what's called self-regulation. To come down and say, okay, I've got a choice here. I can get back in control here. But it takes practice.
Yeah. So what would you tell somebody that's struggling with getting help, that maybe is embarrassed, shameful, doesn't really know how to ask for help, wants to maybe do therapy, but doesn't know how to start that process? What would you suggest to someone out there that's struggling? What would the first steps be for them to get the help?
First of all, it's the destigmatizing therapy, because there's still, in different cultures, the thought that only crazy people go to therapy.
So far from the truth.
Yeah, exactly. So I think one of the things with COVID is that there have been more ads for mental health. It's billboards, radio ads. That's been one of the blessings of this, is that it's messaging that, hey, if you're struggling a little bit, go get some help. And sometimes maybe just calling up like a therapy line. Calling up and just kind of getting a feeler for this is what can happen, because it's confidential. So, I think the helplines are fantastic. They may be a little overloaded right now, as are a lot of therapists. So just understanding that when they do get to that point of getting help, I think probably something within the inside's going, that's great. We need to get some help. It's that inner warrior that you listen to, that inner voice that says, okay, it's time. Because if you don't do this, you may end up dying.
Yeah, absolutely. With that inner warrior, I know you have that inner warrior. You're on the front lines. You're helping people every day through their struggles.
So are you.
Thank you. How do you keep that passion alive? How do you keep that drive to do what you do and not get burnt out?
burnout from time to time, I'll be honest.
And how do you deal with that? What do you do?
I try to take a vacation.
Okay.
Yeah, and I'm halfway vaccinated and waiting for the other shot, but I have 2 vacations coming up to go and see family that I haven't seen for a while.
How do you keep the passion?
Remembering the commitment I made to myself when I was 14.
And what was that? I wanted to ask you about that. So 14 years old, you decided you wanted to be a therapist. What was that conversation you had with yourself?
Oh, jeez. I think I just kept telling myself, if I get through certain issues, and I also started getting therapy when I was young. I was about 8 when I started doing therapy in school. If I got through certain issues, that I was going to turn around and help other people, because it was just good karma. It was just, I always liked helping people. I probably was a natural therapist within my household and to my friends, because I just, I care about people. I hate to see people suffering.
You're an old soul, that's for sure. It's beautiful. So I love that you didn't go to school until your 40s. I think, February, the month of February is all strong women on the show, and you are such a strong woman. I just love that you started in your 40s, and especially with what you're doing. It's not an easy degree. It's a lot of work. And for you to do that in your 40s, I think is just so motivating and inspiring to men and women out there that feel they're in their 40s and they can't start over again. They can't do that. So what was that like for you starting down that road when you first started school in your 40s? What did that feel like emotionally?
First of all, I was the oldest person in my cohort.
What was that like?
It was a little weird, honestly. But it was interesting because I work with a lot of people in their 20s, so I got to see what millennials' perspective, and it was in classroom. It was a teaching for me too, to sit there and understand that different problems, different ways of looking at things. The way that social media has shaped so many lives from about age 40 on down. It's been really fascinating because I didn't grow up with that. So it's been a good learning situation. And I think, with the therapists that I keep in contact with, they kind of look at me as like an aunt.
Okay. At least not a mom. You got the aunt.
Yeah, an aunt. Yeah.
What's one thing that you have learned from a client that has stuck with you?
Good question. Because I learn from so many different clients. Yeah, I hopefully learn a little bit every time I do a session. I think probably one of the deeper lessons is that a person will only let me into their personal life up to a certain point, and I'm not going to push past that, because I don't think that that's good to sit there and push too much. Maybe prod a little bit, but not push, because they've been pushed by other people before. And they don't need to go through that situation. It's like being re-traumatized. And I don't think anybody should put anybody through that.
Yeah, good answer. What would you tell somebody out there that's still struggling with addiction or mental health? What would be your advice to them right now?
Get help. Please get help.
And what would that look like?
Whatever way that they're comfortable at first. And I know with a lot of people who use, they get to certain points where they're tired of hearing friends and family say, you need to go get help. It's really, again, coming down to honor yourself, honor your life.
Honor yourself, honor your life. Recovery, in your own words, describe it.
It's a journey.
A journey.
And it's a journey that, you know, even after you get out of treatment, it's going to continue. And that you have to make a commitment to yourself to stay on board. And sometimes slipping every once in a while is slipping every once in a while. Just as long as, you know, I just call it a hiccup. But just don't stay on board in that. And you're relapsing, especially, you know, with heroin and opioids, it's 40 to 60% relapse rate. So it's pretty high. So realizing the things that you have going against you, but saying, you know what, I'm going to win. I'm not going to let that substance take over my life. I'm going to be the one that's in charge. I can sit there and say no eventually. But
Great advice.
keeping that commitment
Keeping that commitment.
to oneself and then to others. The accountability, I think, is really important. The socializing, the connection with other people.
Right, therapy is connection. You know, doing this is connection. You know, it's something that we need to do as human beings, is to stay connected, especially in these times more than ever, as we're seeing, to stay connected. So thank you for connecting with me today.
Thank you, Jennifer.
Thanks for coming on the show. I really appreciate it. Stay connected, everybody. Thank you so much. See you next time. Bye.